Thank you. Thank you very much, and good afternoon, ladies and gentlemen. It's a pleasure again to welcome you to the second plenary of the World Reconstruction Conference. The session is about reconstructing or recovery towards a sustainable future, building resilience through recovery in a COVID-transformed world. As we go into the session, before we do that, I'd like to invite the speakers who are here in the room with me. I'd first like to invite Ms. Claudia Herrera, the Executive Secretary for Coordination Center for Disaster Preparedness in Prevention in Central America and Dominican Republic. Claudia. Next, I'd like to invite Mr. Harsan Nyambe. Mr. Harsan Nyambe, to please join us on the dais. Harsan Nyambe is the director from the AUC, African Union Commission. Please do join us. And finally, I'd like to invite Dr. Rianti from Asean Center. Thank you very much. And we hope to have two panelists online with us today. We have Dr. Park, the Chief Economist from Asian Development Bank. I don't know if we can see him. And we also should have Mr. Klaas Andersen, Senior Crisis Planner from EU Foreign Policy Instruments. Thank you, Dr. Park. Do we have a class as well? So let's begin, even as our online panelists are coming. In this particular session, we've heard a little bit about in the opening ceremony as well as in the opening plenary, a little bit about the deep experiences that we have gathered on the pandemic. So we are going to dig deep into the social and economic impacts of the pandemic, not to dwell on it, but to look at strategies and examples of how recovery has taken place in the pandemic. This theme is more relevant than ever now, even as we are all trying to move or live through the crisis, and the only crisis possibly that has impacted every individual sitting in this room in different countries all over the globe. And for some people, it might have been even worse. Many of us whom we know have lost loved ones, lost jobs, but far worse, including the people of having the dignity of being uprooted from their homes and starting over. So as we start this session, we'd like to remember all those people who have lost their lives, but also families who have lost their loved ones today, in honor and respect for their family members and the loss that they've had. As disaster recovery practitioners, we were challenged to think on our feet and provide solutions, even as we ourselves were affected. And last of all, I realized this is not the usual scenario that we practiced. We always have scenarios for earthquake, for floods, and volcanic eruptions. We never practiced a scenario for the pandemic. So, this is something totally new. And all of us, whether it was people, local communities, governments, regional intergovernmental organizations, we all, quickly, organized ourselves to support each other, reach out across countries, across regions, to collectively manage this crisis and work towards supporting communities. So today we have with us, we will hear experiences from 3 regional intergovernmental organizations, and we are fortunate to have all of them represented here, from Preparedness, from AUC, the African Union Commission, and the Asean. But we also have Mr. Park, the Asian Development Bank, and European Union, Klaas Andersen, and we will also listen to a Human Development Director from UNDP. The objective of the session is to respond to 3 questions. What was the impact of the pandemic on development targets, and how could we reverse those trends? What approaches were used to identify the socioeconomic impact of the pandemic? And what are the lessons emerging from implementation of recovery that contributes towards resilience, but also in the long term to decrease the impact of climate change, addressing also how we meet the targets of sustainable development goals and other things. I now, before we start our first session, I would like to introduce our first speaker, who's unfortunately could not join in person because of the time difference. This is Pedro Consercio, the Director, Human Development Office, UNDP. He's an economist and physicist by training with a PhD in public policy. Pedro went on to become the Chief Economist in UNDP's Africa Bureau and a strategy director for strategy policy in the Human Development Office. As an author of several books, Pedro has led very recently a very interesting report, if you would like to read it, on human security, and the last human development report, which talks about uncertain times, unsettled lives, more about the impact of the Anthropocene. So I now request to play the video from Pedro.
Thank you for the invitation to address the conference. I would like to share some reflections that place the theme of reconstruction in the context of a series of events that range from COVID-19 to the war in Ukraine that have resulted in huge, even unprecedented shocks to human development. A useful frame to consider much of what is happening and what it means is associated with the concept of human security that was the subject of a special report that we launched a few weeks ago. And I would like to reflect on the relevance of this concept for the challenges that we're confronting and its impact on human development as a way to frame implications also for reconstruction. So human security was introduced in a human development report almost 30 years ago. But it is actually acquiring heightened relevance in today's world. Human security adds to concerns with territorial security, a focus on people, and it asks if people are free from want, free from fear, and free from indignity, taking us directly to the language and principles of the United Nations Charter. We found in our analysis that even before the tragedy currently unfolding in the Ukraine, which is challenging some of our assumptions about international peace and security architecture, the world was not doing well on human security. 6 out of every 7 people globally were feeling insecure about many aspects of their life. This at a time when average standards of living, health, and education were the highest on record. In fact, some of the highest increases in the perceptions of human insecurity took place in countries with very high levels of the Human Development Index. And just last month, after COVID-19, the war on Ukraine, results of a survey in the United States found that 87% of adults in the country feel that there's been a constant stream of crisis without a break for the last 2 years. In fact, almost 2/3 agree that life since COVID-19 pandemic has been a blur. Now, why are people feeling insecure? We argue that there are very good and objective reasons. They result from the intersection of what we call an Anthropocene reality with inequalities. The Anthropocene is a concept that is still being debated by the scientific community, particularly amongst geologists, on whether it becomes something that can characterize a new geological epoch. But we think that it's a useful frame to bring together challenges ranging from COVID-19, which may be the latest in a series of zoonotic diseases that have become more frequent in their emergence or re-emergence, to climate change and biodiversity loss. All of these are manifestations of a broader process of planetary change that is making for a more dangerous world, and where these dangers carve deeper inequalities between those that contribute to the dangers and those suffering the consequences. For instance, in that special report, we find that up to 40 million deaths can be attributed to climate change by the end of the century, overwhelmingly in countries with low levels of the Human Development Index, even in a scenario where we have moderate action to mitigate climate change. Our report documents how this dynamic, this interaction between the Anthropocene reality and inequalities is playing out through disruptions to food systems, the forced displacement of people, new health threats, the amplification of triggers of violent conflict, the destruction of physical and natural capital, the erosion of the ability of people to work, and the continued assault on human dignity through many forms of discrimination. Moreover, these challenges are interlinked and connected in many different ways and propagate across countries and across sectors. So if we take COVID-19, which may, once again, I emphasize, very well be one of the possible manifestations of this current Anthropocene context, we know that it started essentially as a health concern in a particular part of the world, and it quickly spread globally. And it multiplied from a health challenge into a global economic recession and an unprecedented education crisis as schools had to close or went online in many parts of the world, with implications that are still hard to fully grasp. So what would be ideas on the way forward? Again, keeping the human security frame concept in mind, it's crucial to reaffirm the importance of building human security strategies that seek to protect and empower people. This was an idea put forward by Sadako Ogata and Amartya Sen almost 20 years ago when they led the effort that resulted in the publication of a report called Human Security Now. But we argue that it's today essential to advance two extensions. First, to recognize that we have a blind spot in measuring progress and assessing policies by focusing on well-being achievements and perhaps neglecting agency. That is, we often see people as patients, not agents able to reason and act to shape different futures. Second, in addition to the empowerment protection of individuals, human security strategies should in today's world seek to advance solidarity, understood not as optional charity or something that subsumes the individual to the interests of a collective, but as a recognition of our interdependence in one another, and also between people and planet, as recognized in the 2030 Agenda for Sustainable Development. So let me conclude with one important finding from our analysis, where we show that there is a strong association between people feeling insecure and low levels of trust in one another. This association holds regardless of where people live, how satisfied they are with their lives. Therefore, as we confront a world of rising geopolitical tensions, perhaps enhancing human security may offer a route towards rebuilding trust, also echoing a priority highlighted by the United Nations Secretary General recent report, Our Common Agenda. Thank you.
Thank you. Thank you. When we were sitting there, I wasn't sure the screen was working very well because the light was shining on it. But I think the reason Pedro brought us into the frame of human security is because as he kind of says, it kind of talks about the three things that people really want most in their lives. That is to be free from want, free from fear, and free from indignity. So he's kind of framing around all that people have faced over the last few years, particularly due to the interface of human activity, about in the frame of human security. And so it's important that while we are addressing zoonotic diseases, biodiversity loss, some impacts of climate change and disasters, we keep in mind and take a step back that at the end of the day, these are the three big things that people need in their lives. So when we measure progress, instead of measuring progress of maybe some infrastructure or measuring progress of against some sort of one or two social indicators, we should look at broader outcomes of life, which is very important. And the second thing I think what he was talking about is that we have to stop seeing people as beneficiaries. not as patients, I think that's the word he used, not as patients, but as people who can argue and reason, and they can shape their own future. And it was interesting because we were sitting in a prior session and there was one speaker who was talking about that as well. And so I think one is to recognize our interdependencies with each other, but also as people, we should be able to focus on one another and then relate to the planet. So with that, I think we end Dr. Pedro's video, and I'd like to now move on to our second speaker for the day, Dr. Albert Park, if he's online. Dr. Albert Park is the Chief Economist at the Asian Development Bank. He is joining us live online. Dr. Park has more than 2 decades of experience as a development economist that has worked on a broad range of issues, including poverty, inequality, intergenerational mobility, microfinance, migration, and labor markets. Dr. Park is the Chair Professor of Economics and Director of the Center for Economic Policy. And now I invite Dr. Park to start his presentations.
Thank you very much. It's a great pleasure to be here to share some thoughts on the challenges that economies in the region have in achieving a sustainable recovery from the COVID pandemic. Will someone share the slides? So maybe I can, please go to the next slide. One thing that we know has happened from the pandemic, and this is based on analysis we've done at the ADB, is that in Asia, an additional 75 to 80 million absolute poor were created in 2020. So basically the pandemic has set back poverty reduction by 2 full years. And that's created tremendous challenges for governments that want to continue making progress on sustainable development goals. Next slide, please. The recovery has also been very unequal across regions within Asia. You can see here that if we just project where GDP would have been if there had been no pandemic and just plot those trend lines into the future and then compare it to the actual trajectory due to COVID, you can see that there's these big gaps between where countries are in terms of their level of economic development and what they would have been had there been no pandemic. And those gaps are particularly large in the Pacific Island countries that have really suffered from loss of tourism. But also the gaps are very large in Southeast Asia, which is a very dynamic region of Asia, and as well in South Asia. Central Asia is also struggling, especially with all of the impacts of the war in Ukraine. Next slide, please. We know that governments realized the great challenge and responded fairly aggressively, expanding social protection systems. In fact, the coverage of many social protection systems really grew to an extent that was really unprecedented, and in some ways created progress in the ability of governments to reach vulnerable groups because they felt such a strong need to do so, given the challenge of the pandemic. However, it's been hard to sustain the levels of spending on social protection because of the challenges to government deficits and the lack of sufficient government revenues. Next slide, please. We also know that there were a lot of shocks that have had potentially important scarring effects. So for instance, youth unemployment really increased tremendously during the pandemic. And we know from research in labor markets that this can have a long-term scarring effect on the ability of individuals to kind of enter the labor market and get on track on positive kind of career trajectories. Next slide. In addition, we've done some research at ADB on the impact of the long school closures that occurred due to the pandemic. And the learning losses were pretty substantial because in many Asian countries, schools were closed for an extended period of time. And you can, of course, predict that lower learning levels are going to lead to lower productivity and lower incomes in the future. And this figure plots these estimates for the degree of learning lost income due to learning loss. And overall, we estimate that the lost future income is equivalent to 13% of regional GDP, which is quite a large amount. And in this figure, we also show that there was a lot of inequalities in these income losses due to the learning impacts. So those in the poorest quintile of the population had percentage income losses that were much greater than those than rich quartiles. And similarly, on the right-hand side, girls were more affected than boys. Next slide, please. So governments are really challenged because after several years of the pandemic, many countries have higher debt levels and limited fiscal resources. There are these scarring effects that are really important to deal with to maintain medium and long-term growth. And we have these new challenges of the Russia-Ukraine war, US Fed tightening, inflation risk, and an economic slowdown in China this year. Now, governments have many ways to respond, and we have been endorsing and supporting governments to increase vaccination rates, avoid unnecessary lockdowns, think of ways to mobilize more domestic resources, tax revenues, to be able to be more active to support recovery, start addressing these scarring issues in the medium term, and finally, think about efforts to create labor market institutions and policies that will support the creation of decent jobs. Next slide. One thing we see is that there's quite a lot of scope for governments to increase tax revenue as a share of GDP. In Asia, it's still relatively low, whether you compare it to OECD countries or Latin American countries. Next slide. One program that ADB funded in the Philippines is an integrated kind of graduation approach to supporting the poor, which combined a number of different interventions. And we found that during COVID, this really allowed households to maintain food production, livelihoods, and feed their own families and even supply the community with food. So this was very successful. And this was an evaluation based on a randomized control trial, so quite convincing. Next slide, please. So let me conclude by saying we're still optimistic that Asia can achieve a sustainable recovery. We have to remember that Asia overall is still the most dynamic region in the world. There's been resilient recovery in exports, FDI, and regional economic integration, even through the pandemic. And the real challenge now is to balance all of these multiple objectives, given scarce resources. Efforts are going to have to be much more targeted probably than before to really help the vulnerable while maintaining kind of macro stability. And let me stop there and thank you for your attention.
Thank you very much, Dr. Park. I think you have kind of nicely summarized the big impacts of the pandemic on Asia in the region. Just listening to the fact that about 70, 80 million people almost are being added into poverty in this particular region where we have seen a rising trend in middle-income countries is quite disheartening at the moment. We also noted, as with other regions, that there was a high use of social protection as an instrument to support, but then you also warn us that, it is not sustainable because it was ramped up for a very short time. And so I think you will also listen to other speakers where social protection has been used, a very strong mechanism. But I'd also like to, again, draw your attention to the fact that you talked about 4 ways forward. One, of course, is to avoid unnecessary lockdowns so that economic activities continue on, and so then lives and livelihoods can actually be recover and be better off. Then, of course, you talked about using resources much more efficiently. focusing on job creation because unemployed youth seem to be the highest band in this particular region, and also how to minimize learning losses. So I think your example specifically about the Philippines was very striking to me because what we see that the solutions in the end are quite simple. You know, you provide a basket of or suite of options for communities to draw on or households to draw on, and they rely on that for their self-sufficiency or to cope through the crisis, you know. And so whether you were talking about local food production, I saw that picture when you sent the presentation about a woman with food production, local jobs, that is critical. And to me, this was the most, when you think through the whole pandemic, most of us have gone through this phase and then we have wanted to move away from the city, go into rural areas outside, have our own little garden, grow our own food, and live a self-sustaining life because too much dependency has actually helped the virus to jump very quickly. So thank you, Dr. Park, for that. We will now move to our panel discussion. And for our panel discussion today, we already have here Mr. Harsan Nyambe as the first panelist. Then we will hear online from Dr. Jalil from the Asean Directorate. Then the third person we will hear is Honorable Minister Hatan. He will also speak online. Unfortunately, despite making plans to be here, Dominican Republic, there was too many glitches for him to arrive on time, so he's also speaking online. Then we have the pleasure of having, Claudia here with us. She will speak. And then the final speaker for today will be Klaus Anderson from EU. So I'd like to now invite our first panelist, Mr. Harsan Nyambe. Mr. Nyambe has about 25 years of experience with national and international organizations in the area of natural resources, environment management, with an emphasis on agriculture, water, forestry, and tourism sector. He was teaching environmental impact assessment and ecology at the University of Namibia. His passion lies in fostering sustainable natural resource management, of course, and building resilience to environmental shocks. Thank you, Mr. Nyambe, for joining us for this panel. The floor is yours. It's up to you.
Thank you, Madam Moderator, and let me thank you for inviting the African Union Commission to be able to be part of this very important gathering. And in terms of COVID-19, it is quite clear that as a continent, we were expected, in fact, to lose more lives, given the fact that our health systems are not up to standard, and the predictions were actually quite alarming. But fortunately, we proved the world wrong in the sense that despite all factors being constant, the death rates on Africa was actually much lower than expected, and to us, we consider that as a blessing. It is also important to underline the fact that when COVID struck, we already had some of the challenges in terms of disasters. Some of the parts of Africa were experiencing conflicts, and others had challenges related to locusts, which were actually destroying crops. But apart from that, we also had pockets of Africa that were actually struck by floods as well as drought. However, through all these, we realized that vulnerability was exposed, and the most vulnerable actually suffered. But one of the major impact in Africa was actually the socio-economic dimension. And to that end, we realized that our economies in general shrunk by 2.1%. And the children actually who were out of school also were affected because like the other presenters have already indicated, Kids were out of school for quite some time, and our experience, or what we witnessed, was the fact that a lot of some of the girls actually succumbed to pregnancy, and some of them were actually also abused, but some of them also ended up into early marriages. So those were some of the challenges that we faced from a social point of view. But we also realized that some of the critical diseases were actually neglected because all the attention was actually focusing on COVID, and statistics indicate that, for example, 12.9 million people in 2019 received medication or retroviral drugs which relate to HIV, but in 2020, only 10.1 million were able to collect their drugs, and that is quite clear that we were distracted in addressing some of the most important needs as well. I'm actually halfway to finish. Thank you. So basically, we also noticed that our regions, or our continent is divided into 5 regions, and we noticed that each region actually reacted differently to some of these issues of COVID, and some of them actually put measures into place to be able to address the socio-economic aspects by providing food aid, if you will, and others embarked on cash, providing cash or financial means to be able to support their people. And in the process also, we were able to digitize receipt of funds, for some of the areas that did not have those facilities. So basically, at the end of the day, there were lessons that we actually learned from there. And one of them being the fact that we tend to wait for disasters to strike before we respond, which is actually a traditional challenge that we are facing. But apart from that, the issue of distraction that I've already indicated, we get distracted quickly. Once there's a new disaster, we forget about the old ones and move on with the new ones. And we also realized something that was quite disturbing, in the sense that this world is still unequal, because what happened is that it was very difficult for the continent to access vaccines. But in addition to that, there were also measures which I'll call, for lack of words, discriminatory measures against Africa, in the sense that some of the strains that were actually, or variances that were actually identified in Africa, were also spreading in Europe, as an example. And yet, there were countries who locked their borders towards Africa and not towards the European countries, which were also having the same variants. And I think that is quite clear that we still have a long way to go in terms of addressing multilateralism issues or related issues. And given that situation, our heads of states and governments quickly took this matter seriously of COVID, and they put measures in place and called for a coordinated approach to addressing issues of COVID. And in addition to that, they also went further to hold a summit to mobilize funds for recovery as far as COVID is concerned. And we were then able to work with UNDP also to develop a framework, or a resilience framework, so that we can be able to structure our recovery towards COVID-19. But we also have another arm where we also developed a recovery framework that relates to greening our recovery through the support of the UK government. So at the end of the day, we have got a framework We have got frameworks that are actually helping us to be able to recover, and the next steps are actually to develop monitoring and reporting tools for the frameworks that are in place, and to make sure that we are able to disseminate those widely to get the buy-in of member states, and of course mobilizing resources for their implementation. It's time up. Thank you very much.
Thank you, Mr. Nyambe. I think the first point you made is that the region is quite complex, the continent of Africa. So it's a vast region. You have 5 sub-regions in there, and therefore the challenges presented is large. At the same time, I think you also mentioned about the fact that, you know, their prediction and modeling about the lives lost during COVID-19 fortunately did not come true. We still have to figure out what was it that stopped the spread of the virus there in the same way it did in Europe and Americas. The deaths were relatively less. However, the socio-economic impacts were very, very high. You particularly mentioned and brought to the attention of this audience the inequalities and discriminatory measures that particularly the region had to face. That was globally announced about border closures that affected trade, commerce, movement of people, and possibly every aspect of life. And that, I think, is the underlying theme of COVID-19 is inequalities, rising inequalities in the world. More than ever, it revealed itself, whether it was in developed economies or in, you know, in developing economies. It didn't make a difference anywhere. Within each country, you could see that very sharp divide about people who had access to resources, services, and some didn't have. But I think we were also, you know, resonated with your understanding that we are always reactive to a disaster, and we never prepared well enough. So that's one of the key messages I hear from your presentation. Thank you for your presentation and your leadership in the AUC. Thank you. We will move to our next panelist. This is also a video message from Dr. Jalil. Dr. Jalil is the Director of Asean Integration Monitoring Directorate at the Asean Secretariat. He holds a PhD in economics. He oversees the systematic monitoring and implementation of ASEAN's regional economic integration agenda. He used to be the senior economist at the Islamic Development Bank in Jeddah. Unfortunately, he could not join in his person. His colleague, Dr. Rianti, who leads the DRR related work of ADMAR, the Agreement on Disaster Risk Management for ASEAN. She's here. She has several years of experience in disaster risk management. She will respond to questions a little later once the video is played on. Thank you very much. Please play the video.
How ASEAN is addressing this impact to build resilience in the post-pandemic recovery. So I'll start by sharing with you some of the impacts of the pandemic to the region. ASEAN has been severely impacted in terms of our growth, which was down by more than 3% in 2020. But however, in 2021, we started to recover from the downturn with a growth of around 2.9%. And this is expected to be higher in 2022 by 4.9%. So growth will be supported by resilient sectors such as agriculture, construction, manufacturing, and ICT, as well as increased demand in commodity products and robust investment in services and manufacturing, as well as tech industries. However, we should bear in mind growth prospects remain fragile, particularly given the increasing uncertainty in the global environment, such as the crisis that we are currently witnessing in Ukraine and Russia. The impact of the pandemic on the region can also be felt in other dimensions. A case in point is in terms of poverty numbers. Due to the pandemic, number of the poor in the region has increased, and the pandemic has pushed more than 10 million people to extreme poverty level. So this has hampered the 20-year progress that we have made in terms of poverty alleviations in the region. Another example is the tourism sector, which is a very important sector for the region in terms of its contribution to growth as well as employment. The sector has been among the hardest hit sector by the pandemic. We can see here that visitor arrival to ASEAN have declined by more than 82% from 143.6 million arrival in 2019 to less than 3 million arrival in 2021. However, we expect that there will be recovering, especially given the reopening policies that are currently taking place across the region. So on the other hand, several other indicators point to the relatively strong recovery process in the region. For example, labor force participation is expected to improve, while unemployment is projected to decrease with considerable reductions in youth unemployment. Another major point is the fact that the pandemic has also led to the accelerations in the digital transformations. This is reflected, among others, by the continuous increase in terms of internet penetrations in the region. So these digitalizations transformation will further support recovery process through, among others, streamlining of travel protocol, recovery in the tourism sector, as well as expanding economic and education access to the most vulnerable in the post-pandemic world. One of the main contributing factors toward our region recovery is the great stride that has been made by all the AMS in terms of the rolling out of their vaccination program. So I'm pleased to share that more than 65% of ASEAN population has been fully vaccinated as of now. And we are clearly on course to achieve the target set by the WHO to vaccinate around 70% of population by mid-2020. And currently we are in the process of starting rolling out booster vaccination. 21% of our population have received booster vaccination. This booster vaccination will be further improved, notably through the use of the COVID-19 ASEAN Response Fund. So in addition to national level initiative, ASEAN has also put in place regional framework in order for us to complement our member state in their national efforts. This regional level effort is encapsulated in the ACRF, which is the ASEAN Comprehensive Recovery Framework, which is aimed as the whole of community exit strategy for ASEAN to recover from COVID-19, as well as to address short-term impact of the pandemic during reopening, recovery, as well as resilient phases. When we developed this ACRF, we have undertaken consultation with all our stakeholders, including the business sectors, as well as our external partners, and all the entities that are associated with ASEAN. This is in order for us to ensure that the framework took into account all the needs as well as the expectations of all our stakeholders. Just to inform that the framework comprises of 5 broad strategies: enhancing health systems, strengthening human security, maximizing the potential of intra-ASEAN market and economic integration, accelerating inclusive digital transformation, as well as advancing sustainable and resilient future. In developing this framework, we also take into considerations SDGs. We have incorporated across the 5 broad strategies of ACRF prioritized areas in the SDGs. In the development of the ACRF, we put a lot of emphasis on stakeholder engagement as well as partnership. So we emphasize the whole of community approach in our recovery efforts that straddle across the 3 pillars. So this is for us to ensure that centrality is strengthened in the post-pandemic regional architecture. Private sector engagement is also crucial for us to expand the regional recovery effort to be more holistic, inclusive, and sustainable. The private sector has also provided capacity building for the most affected vulnerable communities as well as the MSMEs. Examples of initiatives that are developed using these approaches of inclusiveness is, for example, the ASEAN +3 Emergency Rice Reserve Initiative, which is aimed to provide assurance of food security in the region, which include provisions of food assistance during disaster, the establishments of the ASEAN Regional Reserve on medical supply, as well as the establishment of the COVID-19 ASEAN Response Fund. I would also like to share that we have also signed an MOU with the OECD, which will outline potential collaborations in more than 35 policy areas that will support our recovery process. I would also like to highlight that one of the priority areas in the ACRF is enhancing resilience of development in the post-pandemic through the promotions of sustainability, which include disaster management. In this regard, I would like to inform that sectoral collaboration as well as stakeholder contributions have been pivotal in endeavoring resilience for the recovery process. In this regard, we have launched the ASEAN Regional of Action to Drought, ARPA-AD, which is aimed to enhance coordinations at the regional and national as well as international level to consider the impact of drought in the region. And then we have also launched the ASEAN mapping exercise to promote synergy with other relevant ASEAN sector bodies, ASEAN centers, and entities that are associated with ASEAN on disaster management. I would also like to take this opportunity to encourage our partners to support the ASEAN Disaster Management and Emergency Relief Fund, which is open to voluntary and non-restricted contribution to address disaster management and emergency response in the region. Finally, I would also like to inform that inclusivity remain key to safeguard livelihood. And then we acknowledge this. In this regard, we have launched the ASEAN Regional Framework on Protection, Gender and Inclusion in Disaster Management 2021 to 2025, which will incorporate gender lens to achieve more inclusive disaster management. To conclude, I would like to inform that our objective is to alleviate the uneven impact which are caused by the pandemic, particularly on the most vulnerable group. And then in order for us to ensure that no one will be left behind, contributions and support from wide range institutions and governance mechanisms, as well as further stakeholder engagement and partnership has been meaningful and continue to be important for us to recover from the pandemic. However, I would also like to point to the fact that doing business as usual will no longer be an option for ASEAN in this post-pandemic world. It is important for us to undertake a paradigm shift for government, businesses, and civil society, for us to work collectively to enable systemic change for us to have a sustainable and resilient future. And I would like to reiterate the importance of a whole community approach in our recovery process. And this will involve inviting wide range of stakeholder contributions to support us in our recovery process and for us to regain the hard-won development setback in terms of poverty, unemployment, gender inequality, and learning loss caused by the pandemic. With that, I end my presentation. Thank you.
Thank you. Thank you, Dr. Jalil. I think we were very intrigued when we saw online the ASEAN Comprehensive Recovery Framework. We read it and we were very pleased to see that it addresses issues of accelerating digital transformation, issues of human security, whole of community approach, as mentioned here, plus of course what ASEAN as an intergovernmental organization has done through the Emergency Response Fund in supporting countries. So thank you very much for that. We'll come back to questions later, probably Dr. Yanti. We will next see a video from Mr. Miguel Sierra Haton. I apologize, probably we'll have now Ms. Claudia speaking. Claudia will speak in Spanish. It is my pleasure actually to introduce Claudia. We've heard about each other, but we met only yesterday. And it was a pleasure that she could join us today. Thank you very much, Claudia. Claudia has 20 years of experience in the approach of integral disaster risk management. She has been part of the team responsible for harmonization of the Central American policy on integral disaster risk management with the Sendai framework until its approval at the Summit of Presidents and Heads of State in SICA. Claudia also is the first woman to head Preparedness in a very long time. In fact, the first woman to head. So kudos also to that. Claudia, the floor is to you.
Thank you very much. Thank you for the applause. I'm really grateful to have this opportunity to share about our organization and also to share about the challenges and also the strength that we have in our region. Mi nombre es Claudia Herrera, soy la secretaria ejecutiva del Centro de Coordinación para la Prevención de los Desastres en América Central y República Dominicana. Somos la instancia especializada dentro del sistema de la integración centroamericana a cargo de la temática de gestión integral de riesgo y adaptación al cambio climático. Coordinamos las actividades con los entes rectores de gestión integral de riesgo y protección civil de 7 países de la región, todo Centroamérica y República Dominicana. Hoy tengo la oportunidad de compartirles el tremendo desafío que ha representado el COVID-19 en nuestra región. Desde marzo del 2020, nuestra región ha sido seriamente afectada bajo un escenario complejo, no únicamente afectado por el COVID-19, sino que también por alrededor de 30 eventos hidrometeorológicos, el incremento de actividades geológicas, el incremento de actividades volcanológicas y todas las afectaciones de estas amenazas geológicas que también se ve cada vez más expuesta y más vulnerable nuestra región. Somos una región multiamenaza, no solamente por nuestra condición geográfica, sino que también por el impacto del cambio climático. Sin embargo, desde el 2020, desde el inicio de la pandemia en nuestra región en marzo, hubo una declaratoria de nuestros presidentes, nuestros jefes de Estado, a través de la declaratoria Centroamérica Unida contra el Coronavirus, el cual incorporaba 3 ejes temáticos principalmente: el abordaje de la gestión integral de riesgo y la salud de forma conjunta, el abordaje del impacto económico y el impacto social. A través de estos esfuerzos, de forma conjunta, los 7 países fuimos decretando acciones para desarrollar estos esfuerzos conjuntos que nos llevara a identificar esos impactos diferenciados en la población expuesta y vulnerable. Coincido completamente con que nuestra población no debe ser vista como una población beneficiaria. Nosotros demandamos que sea vista como protagonistas de un cambio y que podamos aprovechar este tremendo desafío que nos ha generado el COVID-19 y estos escenarios complejos para lograr identificar esas acciones acertadas que nos permitan reducir el impacto, orientar nuestros esfuerzos para atender esa población que está cada vez más expuesta y más vulnerable. En el marco de esas acciones pudimos desarrollar una plataforma del COVID-19 que nos generó toda la infraestructura expuesta, la población afectada por el COVID-19, pero ante el inicio también de una temporada ciclónica más activa de lo normal, con eventos más recurrentes, con mayor intensidad, nos vimos en la necesidad de desarrollar instrumentos tecnológicos que nos permitieran analizar ese escenario complejo. Y pudimos trasladar esta información a los centros de operaciones de emergencia para analizar cuál era el impacto de esa población en relación al género, en relación a la población con discapacidad, en relación a la información también que generara instrumentos y herramientas y metodologías que nos permitieran coordinarnos de mejor manera entre los países en una situación que generó un impacto económico muy serio. Las secuelas de este impacto, hoy precisamente estamos lanzando un policy paper sobre el impacto económico y esa diferencia de la población afectada, sobre todo con el incremento de la afectación en relación al género. También en esta iniciativa pudimos desarrollar la plataforma de información y coordinación regional, lo que nos ha generado también información valiosa para poder desarrollar los procesos de recuperación y reconstrucción con un enfoque de transformación. Y aquí quiero resaltar el esfuerzo que a través del acompañamiento del sistema de las Naciones Unidas, el Banco Mundial y también otras instancias como también la Unión Europea, hicieron el Early Recovery Need Assessment, que también nos permitió ir complementando ese análisis para orientar nuestros planes de recuperación y de reconstrucción. Actualmente también hemos activado el Observatorio de Recuperación por primera vez a nivel mundial, en el que también nos permite ir identificando esas características post-afectación de estos eventos hidrometeorológicos, Nos vimos afectados por 2 huracanes de forma simultánea, ETA y IOTA, y como les decía anteriormente, más de 30 eventos hidrometeorológicos. Entonces, con estos procesos de recuperación y reconstrucción, a través de nuestra plataforma, hemos logrado también generar nuevos instrumentos para desarrollar metodologías para el blindaje climático, el clasificador presupuestario, identificar cuál ha sido la inversión y cuál está siendo la inversión de nuestros gobiernos en relación a evitar la aparición de nuevos escenarios de riesgo y reducir los riesgos existentes. Y aquí pues quiero resaltar nuevamente el esfuerzo que a través del Sistema de las Naciones Unidas, del PNUD, estamos desarrollando para el Post-Disaster Need Assessment, generar grupos especializados en nuestros países que nos permitan también tener esas capacidades instaladas. Creo firmemente que de la única manera que podemos lograr una recuperación con transformación es generando las capacidades directamente en el territorio y que aseguremos que todas nuestras intervenciones, tal cual lo establece nuestra política centroamericana de gestión integral de riesgo, estén orientadas a atender a nuestra población directamente, que estemos generando que el ser humano esté como centro de nuestra intervención y que desarrollemos esfuerzos conjuntos. Por eso nuevamente nos agrada ser parte de estas iniciativas donde podemos compartir experiencias y buenas prácticas y aprender entre nosotros. Muchísimas gracias por la oportunidad nuevamente.
Thank you, Claudia. Very happy to know about the new tool, the digital tool that you have established. I recall you saying that it was a regional coordination information with emphasis on resilience, and then through that tool you were able to give a picture of what has been the impact on households through different, not only for pandemic, but also different disasters that you had in the region. So I think what is important at this point is to be able to share a little bit more about how you can use the tool to support communities, also to, you said, to develop and face climate change and avoid new risk scenarios. We're also happy to hear about that you are thinking of installing recovery capacities within the region so that you can believe in and actually do transformation in communities. So it should be seated in the region so that human beings are much more better supported. Thank you very much, Claudia. With that, we go to our quick next speaker. He's our Minister Hathon. Minister Hathon, unfortunately, as I mentioned earlier, could not make it due to issues in travel. But I'm just looking through my notes. So he's the Minister of Economy, Planning and Development for the Dominican Republic. And we were particularly pleased to work with the Ministry of Economic Development because that is where the central issues related to finance and planning takes place in the Dominican Republic. He's an economist by training, of course, but also a professor as long back as in 1980 with a lot of experience with development agencies. He's also worked in the Human Development Office of UNDP and coordinated and authored about 11 books dealing with the Dominican and Caribbean economies. So we were actually very, very excited about having Minister Hathon here, but we will also be listening to his video. Very grateful to his office also to be able to do this very quickly and send it to us in one day because he was not able to come. Kindly play the video.
Buenos días. Es un honor para mí estar presente en esta quinta conferencia mundial de reconstrucción y debo agradecerle en nombre del gobierno dominicano a las instituciones promotoras de este evento, el Programa de Naciones Unidas para el Desarrollo, el Banco Mundial, la Oficina de Reducción de Riesgo de Desastre y la Plataforma Internacional de Recuperación. Debo iniciar explicándole cómo ha funcionado, dándole un contexto de la economía dominicana para que podamos entender el impacto de la crisis que vivimos en el año 2020. La economía dominicana es la economía que más ha crecido en América Latina desde el año de 1960. Y no solamente hemos crecido, sino que ha sido un crecimiento relativamente estable. Somos la cuarta economía con mayor estabilidad en el crecimiento. En ese contexto se nos presenta la crisis del año 2020. Es la crisis más profunda de los últimos 121 años. Ha afectado a 172 países, es decir, el 90% de los 192 países del mundo registraron un crecimiento negativo. Y esta crisis estuvo acompañada con un tremendo aumento del déficit fiscal, desempleo, informalidad, endeudamiento e inflación. En la República Dominicana esta situación nos condujo a pagar un alto costo. Según la evaluación de las necesidades de recuperación por el COVID, un estudio que preparó el Sistema de Naciones Unidas junto con el gobierno dominicano, el costo de la crisis fue de 18.459 millones de dólares. Este costo está asociado a las actividades que se perdieron, que no se pudieron realizar por el efecto de la pandemia y los aumentos de gastos que tuvimos que hacer para poder sobrevivir en esta situación. Esto determinó que en el año 2020 la economía se derrumbara y cayera en 6.7%. No obstante eso, en el año 2021 se notó una notable recuperación. La economía creció en 12.3% y ese 12.3% equivale a un crecimiento de casi 5% con relación al año 2019. El empleo prácticamente se recuperó, todo el empleo perdido, y la fuente de este crecimiento fue fundamentalmente la inversión privada. Tradicionalmente es el consumo el motor del crecimiento económico en la República Dominicana y casi en la mayoría de los países del mundo. Sin embargo, desde el último trimestre del año 2020, el coeficiente de inversión se colocó por encima del 30% del PIB y se mantuvo durante todo el periodo del 2021 por encima del 30%, explicando casi el 65% del crecimiento registrado en el 2021. Es decir, que del 12.3% del crecimiento del 2021, el 65% era explicado fundamentalmente por la inversión privada. Los sectores que más crecieron fue el turismo, fue la construcción, fue la industria, las industrias de zona franca, el comercio, el transporte, entre otros sectores. Ese crecimiento ayudó a mejorar la situación del empleo. Ahora bien, el déficit acumulado en el año del 2020, equivalente al 7.9% del PIB, condujo a una severa deuda, a un aumento de la deuda. Pero debemos destacar, y es muy importante, que en el año 2021 se produjo una combinación de factores que creo que es única en el mundo. Pudimos crecer mucho, consolidar las finanzas públicas, bajar el déficit de menos 7.9 a 3% del PIB y al mismo tiempo aumentar el empleo de la economía. Esa combinación es una combinación única probablemente en el mundo que se dio en la República Dominicana. Ahora bien, como decía anteriormente, la deuda ha crecido, pero ha crecido en términos absolutos, aunque en términos relativos se ha reducido en porcentaje del PIB. Comparando la deuda pública acumulada entre el 2020 y el año 2022, la deuda ha perdido 10 puntos porcentuales del Producto Interno Bruto. Ahora bien, podemos decir entonces que la economía dominicana ha logrado una recuperación única, una recuperación que ha sido sólida porque se ha basado en el sector privado. Ahora, ¿qué factores han explicado? ¿Qué factores han sido los detonantes de esta situación? En primer lugar, las vacunas, la política de vacunación. Se aplicó una política de vacunación masiva a la población que tuvo indudablemente resultados muy positivos. En segundo lugar, el turismo. El turismo era el sector en el cual menos confiábamos que se iba a recuperar inicialmente. El mundo entero no creía en la recuperación del turismo y el gobierno dominicano apostó a la recuperación del turismo y hemos tenido niveles récords en este momento. En tercer lugar, el apoyo en una política de apoyo claro al sector industrial y al sector agrícola, a través de créditos, a través de facilidades que se le fueron dando a estos sectores y que mostraron una rápida recuperación. En cuarto lugar, debemos reconocer la política monetaria flexible que condujo a facilitar un crédito a las MIPYMES y al sector agropecuario. En quinto lugar está una serie de reformas institucionales importantes que hemos venido ejecutando en los últimos años, pero sobre todo la independencia del Poder Judicial, que ha marcado una diferencia, un antes y después. A esto se le agrega una serie de reformas del aparato productivo, institucional, de la inversión y de otros sectores de la economía. Hemos mejorado la calidad del gasto, hemos mejorado la eficiencia del Estado y hemos tenido una visión estratégica importante que nos ha permitido recuperar la economía. Y esta visión estratégica la generó el presidente de la República, que dio una clara estableció un entusiasmo y una vocación clara a la recuperación de la economía dominicana. Muchas gracias.
Thank you very much. I think it's heartening to hear that one country has actually planned recovery in such a systematic way, implemented it through actually what he's talking about, institutional reforms or governance, good governance that help to take decisions where related to in tourism, there was a rise, supporting of agriculture and industrial economy, flexible monitoring policy for giving access to credit, and so those were the issues. So despite things looking down in most of the countries, it's very good to hear that Minister Hatton has been able to outline what are the key policies the government can take to restore and recover from the economy. Thank you very much again. We move now to our final speaker for today. This is Claes Andersson. We have him online with us. And after Claes speaks, we will take up a couple of questions before we close. And thank you very much for your patience. Claes Andersson is the lead crisis planner in EU's foreign policy instrument. He's a civil engineer by training. He has been a close partner with many of us sitting here in the European Union, as you know, is the largest partner that supports post-crisis assessments, post-crisis related work. Claes leads that work within EU, but also he has worked before that with DG Environment and the Director General RELEX. And before joining EU, he was with the International Labour Organization for several years. I invite Claes to make his presentation last but not the least. Claes, please start your presentation.
Thank you. Good morning from me here in Brussels, and good afternoon to you there in Bali. I don't know the slides. Are they coming on? Yes. This brief presentation on lessons learned, assessing impacts of the pandemic, will focus on the COVID-19 recovery needs assessments, the CRNAs, which is a joint EU-UN World Bank tool. We did an external evaluation of achievements and lessons learned from CRNAs, and in mid-2021, looking at the CRNAs that had been implemented up until then. Next slide, please. Very briefly about the background. We all know COVID-19 a global health crisis that quickly turned into a global socioeconomic crisis. There were a lot of government responses mounted to mitigate economic and human impact. The international community mobilized to support governments. And one of the mobilizations, you can say, was that the partners, the EU and World Bank, from the 2008 Joint Declaration on Post-Crisis Assessment and Recovery Planning, developed the COVID-19 Recovery Needs Assessment tool. It was based on existing tools, the post-disaster needs assessment, and the recovery and peace building needs assessments. Next slide, please. The objectives of the CRNA methodology, it was not about assessing direct impact on health, but rather the overall socioeconomic impact on people, not least vulnerable groups, on services and production of goods, and on governance. This should lead to an identification of priority needs and critical sectors of the economy to restore production of goods and services to get the economy rolling. It would also recommend institutional mechanisms and policy measures to support the recovery. Next slide, please. Lessons learned. The lessons learned here in my presentation, it's divided into two parts. One is positive features of the existing methodology and how it's been used. And the second part is points to improve for the future. So first, on the positive features of the existing, it has a strong conceptual focus on human impact. It lends itself to stock taking of needs and response planning for COVID-19. This is a relatively simple methodology to start with that was then refined through testing, learning by doing, and adapting to local conditions. It builds on strong government ownership, and extensive efforts were done to undertake upfront training of technical counterparts in ministries and agencies and so on. It also initiated internal processes in affected countries, leading to better intra-government coordination on recovery and response planning. Next slide, please. The second part of lessons learned to be improved or to better take into account. It's the fact that it was more difficult to obtain data than was originally expected led to longer timeframes for assessment, and that needs to be taken into account in the future. There is also a stronger focus needed on social cohesion, conflict drivers. There's a need for cross-cutting planning tools adapted to protracted crises, multidimensional crises like COVID, storms, floods, conflict fragility coinciding. Next slide, please. I will not go into the details on these possibilities for what you can call a post-pandemic reset. One of the key drivers, I would say, is the rebalancing that took place under the COVID pandemic between public, social, and economic spending versus debt and deficit management. Next slide, please. Lessons learned. Three main points here. The first point is about better doing CRNAs. That would involve updating tools. That would involve integrating peace building and conflict management expertise. That would also put further strengthening of capacity building because of its key to local ownership. On the second, we could see that CRNAs could be a step towards a tool for assessments in much more dynamic setups, where the crisis is developing while the assessment is undertaken. And this would mean an assessment more focusing on stabilizing and mitigating impact than full-scale recovery, which is usually the objective for like a PDNA. Lastly, we could also use the current dynamics to also revitalize the tripartite partnership, both on looking at assessment methodologies, objectives, and also expand the links with other institutions like regional organizations, like regional development banks. Next slide, please. So thank you very much for listening.
Thank you, class. We are closing. We have very little time. In fact, we have crossed our time. So thank you very much. I will not attempt to summarize what you just said, but noting that how this tool was adapted to have a strong focus on human impact. That was one of the key things that was applied when using this tool and methodology in different countries, including Dominican Republic and AUC as well. Maybe just before we close, if there is a question from the floor, we should at least take one question from the floor. And if we have one online before we just conclude, if there is any question from the floor. Anyone? I don't see any raised hands yet. Okay. There are no questions online as well. I have not seen any questions online. I don't see, at least in my phone. So, so thank you very much. I think I would like to close this, but before closing, maybe I just like to summarize with 2 points. I would have liked to go around again to each panelist who's sitting here at least. Maybe Rianti, if there's one thing that you would want to communicate from this whole session, just give one key message, and then I will try to summarize and close. Yeah.
Yes, thank you very much. The key message for us through the, I think, activities of ASEAN, this ASEAN comprehensive COVID-19 recovery frameworks has been the guiding principles and documents, and through the implementation plan, which guide the 10 member states in terms of their recovery. Second, strong governance processes by which we involve, of course, the agreement of the ASEAN member states, involvement of partners, and also a lot of consultation with private sectors and the communities. And thirdly, one of the components of this ACRF is on resilience, and disaster risk reduction, disaster management has indeed contributed to the achievement and development of this ACRF. Thank you very much.
Mr. Nyambe, 30 seconds.
Thank you. From our end, we have noticed that with these frameworks, we are able to effectively coordinate measures towards recovery and also ensuring that such recovery are actually sustainable. And I think that's the message that we can be able to take home, and we are able to tap into regional economic communities and link up with member states. I submit.
Mi último mensaje sería que para poder lograr una recuperación con transformación y generar la resiliencia en nuestros territorios debemos de abordar un enfoque sistémico, una aproximación intersectorial y una coordinación nacional y regional. Es importante también que todas nuestras acciones estén orientadas a atender las necesidades especiales y esas necesidades específicas del sector social, del sector económico, pero sobre todo de una población que está cada vez más expuesta y más vulnerable y que requiere la articulación de esfuerzos y la complementariedad de recursos entre todos. Gracias.
Thank you very much to this panel members. Thank you also to the audience. Just one key takeaway from me is we've seen how the pandemic has taught us several lessons, among them that we should not view risk as single. Multiple disasters happening at the time of the pandemic, so we should prepare for everything rather than being reactive. The frame of human security. At the end of the day, we are looking for how the well-being of people, which is about free from fear, free from need, and free from indignity. And those are the three things that I would like to go away with. Protecting lives and livelihoods is what we should aim for. Thank you very much, and thank you to the audience. I'd like to again ask you to all give a round of applause to the panelists, but also to all of you for your patient hearing for such a long time. Thank you very much.